Hi guys, Tony Maritato here, licensed physical therapist, and in this video I want to talk to you about choosing the best assisted device for you after your total knee replacement. So here in the US, most patients are discharged from the surgical center with a standard forward wheeled walker. That is the gray walker that has the wheel in the front, the slides on the back, and it's designed to produce stability for you, the patient, while you're walking. Once you're done and don't need that level of support, typically patients will transition to a single point cane. That is the normal traditional cane you would see anybody using in the community. And then you would go to unassisted ambulation, walking without a device. Now, there's definitely some clients that go straight from the walker to nothing. There are some clients that don't even need the walker and go straight to the cane. In other countries, it's common to discharge a patient with crutches. Regular axillary crutches or loft strand crutches, different kinds of crutches are available. But the reality is what's important for you, the patient, is you understand each of these tools has a purpose, and using the right tool at the right time is what is most important. So with the standard forward wheeled walker, this is for stability. This should not really be leaned on. It should be something that glides and rolls and slides in front of you. It's something that's great for when you're tired. It's great for when you're feeling unsteady on your feet. We always say if you're going to wake up in the middle of the night to use the restroom, keep the walker by your bed. Late evenings, early mornings, the walker provides great stability. But as you're progressing and as you're working with your physical therapist, going to a straight point, single point cane can be hugely beneficial, even if you feel like it's not something you need. Because the goal behind the cane is to touch the ground. The cane is not to hold you up. If you're leaning against the cane, if you're putting more than a couple pounds of pressure through the handle of the cane, you're not ready for a cane. The cane is there to help you touch the ground and feel where you're going while you're walking to normalize your gait, your balance. And what's an important component is, in most cases, the cane should go on the opposite side of the knee replacement, unless you're a patient that the replaced knee is the better knee and the next knee surgery is scheduled for a replacement on the other side. But generally speaking, the cane goes on the opposite side of the surgery so that you're walking more symmetrical, more balanced, more midline. And then, of course, once you progress to no assistive device, we really want to focus on technique over quantity. We want you walking well, even if it's shorter distance. So talk to your therapist about feeling the heel strike on the ground, feeling the midfoot, the toe off, having adequate ankle mobility, knee mobility, hip mobility. Pelvic rotation is an important component of walking. This is your opportunity. You have a brand new knee in your body. We want to optimize everything that's surrounding and supporting that knee so that you have the best chance of optimal performance. So guys, if you have questions about assisted devices, if you have questions about anything related to your knee replacement, please subscribe to the channel. Don't hesitate to post your comments below, and I will see you on the next video.